Have you determined that you have SI joint pain and you are confused about all the treatment options that are out there? Maybe you're wondering what physical therapy can do, if you need to see a pelvic floor specialist, or who's the best person to see on your journey with SI joint pain. Well, in today's video, this is what we're going to discuss. Specifically, if you have already determined that you have SI joint pain, what the best treatment options are for you. We'll discuss things like PT, prolotherapy, should you get surgery, as well as some things that you can start doing right now. Now, if you're not sure if the pain you're suffering from is SI joint pain or low back pain, I'm going to encourage you to watch this video right here, where we discuss the difference between low back pain and SI joint pain. In general, though, SI joint pain is felt around the area of the hips or below the low back, because that's where the SI joint is located. So the SI joint is made up of the sacrum and the ilium. The sacrum is the heart-shaped bone that's found at the bottom of your spine, and the ilium are the big bones on each side. Most people call them their hip bones. Many people who have SI joint dysfunction feel a deep, achy pain in the buttock region. So they describe it as there's a pain that's so deep and I wish I could just massage it out. But whenever I try to massage it, maybe with like a massage gun or a racquetball or something like that, it just feels like it's too deep. Often that is SI joint pain. Often patients also complain of pain either with standing for a prolonged period of time, with walking for a prolonged period of time if your SI joint is not moving correctly. And many people with SI joint pain say they have no pain during the day while they're moving and active, but their pain comes on at night. And there's different things that you want to do for those different types of pain. Now, when you go to see a specialist, what can you expect them to do to figure out if what you have going on is SI joint pain? Well, in my clinic, we want to start with a full history. We want to understand when this pain started, if there were any falls, if there's recent childbirth, hormonal changes, and what's been going on along the journey since this pain initially started. So after we listen to your history and get a really clear picture, usually by that point, I'm pretty sure if it's SI joint pain or not, and I have a hypothesis. So of course, we have to prove it. We're going to do some testing. We're going to put our hands on you to do some testing to figure out if it is indeed the SI joint, because every joint can fool you a little bit, so we want to prove our hypothesis. So there's specific hands-on testing that doctors or physical therapists can do to decide if it's an SI joint problem or not. Now, many of my patients ask me, do I need to go see a doctor first? Because of course, they're the ones who can recommend an X-ray or an MRI. Now, I can tell you an X-ray can be helpful in SI joint dysfunction if there's a malalignment issue. So if there's an issue where the ilium is not sitting correctly on the sacrum, remember the ilium's the hip bone, the sacrum's the heart-shaped bone in the center, then an X-ray can be really helpful because it can actually show us that. However, MRIs do not show that malalignment, and we can't see inside the joint itself, even on an MRI. So MRIs are not as helpful in general with SI joint dysfunction. But if you go see a physical therapist who's skilled in manual therapy and preferably pelvic floor disorders, and they'll be able to see what's going on with any malalignment issues you might have. So if you've already been to see the doctor and you have the X-rays, definitely bring them in for your appointment. But if you don't worry about it. We're able to see a lot and feel a lot with our hands. All right, so if you decide to go see a physical therapist for your SI joint dysfunction, what can you expect? Well, the truth of the matter is the goal is to heal the damaged tissue. Now, it could be the joint itself, it could be the ligaments, it could be the muscles, there could be a low back problem that could affect the discs or the vertebrae. So it's really important to have a full evaluation to understand exactly what's going on with your body and how these symptoms are progressing. Every tissue in your body is designed to heal itself as long as it's moving correctly. So if your body hasn't healed itself at this point, there's probably something that's not moving correctly. Therefore, we need to figure out what that is and get it moving correctly so it can heal. Now, as a physical therapist, there's lots of different ways we can do that. Preventatively, we want to do some activity modification to avoid re-injuring that SI joint, as well as making sure we have good biomechanics or body mechanics while we're moving through our daily activities. This can be things as simple as sitting with equal weight on each cheek and not crossing your legs and sitting, or same thing in standing, making sure you have equal weight through both legs. These are the things that we want to do to protect the SI joint while it's healing and also implement for the long term. Now, once we've achieved proper alignment of your spine, we want to give you some exercises and stretches to help you be able to stay there. We need to stretch areas that are tight. We need to strengthen areas that are weak. And this can all sound very, very simple, but it's really important to know which areas are tight and which areas are weak so that you're strengthening the right things, stretching the right things, and not strengthening the things that really just need to be stretched. All of this will help us to restore proper muscle tone, which will help to improve any ligament laxity. If you feel like your SI joint is just kind of sloppy and it moves all over the place, my guess is that you have some ligament laxity. And those ligaments need some time to heal. So we need to make sure that the muscles are doing what they're supposed to be doing and supporting that joint in the correct position so those ligaments have time to heal. So the goals of physical therapy would be A, figure out what's wrong, B, figure out what's irritating it, C, figure out what you are capable of doing because we want to keep you as active as is healthy for you to be, and D, help that body to be able to heal naturally. Now you may be asking yourself, I already saw my doctor and he recommended other forms of therapy other than physical therapy. I'm wondering if those can help for me. So we're going to discuss different things that are done to treat the SI joint, and in general, if I recommend them or not. First up, the most common question I get is regarding prolotherapy. So prolotherapy is an injection that's done to help stimulate healing of the body. In general, as a physical therapist, I am pro prolotherapy because in general, it will help your body to speed up the recovery process. Now, this is particularly true for people who have loose ligaments. It can really help to create more stability through that SI joint. However, I do want to caution you. I've had multiple patients who have had one series of prolotherapy or one treatment and did not get the results they were looking for. So I reached out to a local doctor here who does prolotherapy pretty much full time, and I asked him about this. I said, listen, my patients are not having good results with prolotherapy. Can you tell me why? And he said, yes, the reason why is because they're only doing it once. In his office, what he asks his patients to commit to is 6 treatments of prolotherapy. And if you've looked into prolotherapy, you know that it's not covered by insurance currently, which means 6 visits can get very expensive. However, he recommends 6 visits of prolotherapy in order to get the results that patients are looking for. He said sometimes it's only 4 to 5, but he asks everybody to commit to 6 just in case. He's sure that in 6 visits, he can get this problem taken care of. So that becomes a really tricky question because 6 visits obviously is very expensive when none of it's covered by insurance. Now, I will tell you, I have one patient who I'm currently seeing who had 1 session of prolotherapy before she started to come see me, and she did get the results she was looking for with that 1 session. However, in my 20 plus years of experience as a physical therapist, this is the one and only patient that I've seen that got the results they were looking for after 1 session of prolotherapy. So I definitely encourage you, if you are looking into this option, I think overall it is a great option, but I would definitely want to discuss with the doctor how many sessions he believes it will take and what kind of outcome you can expect. Now, the second most common thing I get asked about is those SI joint belts. And people ask me, do you agree with them or not? First off, in general, there's 2 types of SI joint patients. One is a type of patient who has a malalignment issue that's causing this problem. The second type of patient has a ligament issue or a sloppy SI joint that moves around too much. And that difference is really important. If you find that you have a malalignment issue, you don't want to put an SI joint belt on top of that because it will stabilize you in that position, which is the whole problem in the first place. You're malaligned. However, if you have a sloppy joint or a joint that just moves too much, an SI belt can be very helpful to help stabilize while those ligaments are healing. However, you want to make sure that you put it on correctly. So you need to be instructed by a physical therapist who knows your body and can teach you the proper way to apply it so that it works best for your body. The next thing I recommend my patients work on is making sure they wear proper footwear. Now you may say, well, my feet are pretty far from my SI joint, but your feet are interacting with the ground, and the end of that chain is the SI joint. So we want to make sure as your feet are interacting with the ground that they have the proper support. If you're a supinator, we want to support that. If we're a pronator, we want to support that. We want to make sure that what's going up the chain is a normal reaction force. So if you tend to wear flip-flops a lot or not have really good protection for your feet, definitely going to recommend looking into some good supportive shoes because that will make a world of difference to your SI joint. Now, this next one can get a little tricky, but stick with me for just a second. I'm going to ask you to work on your mind-body connection or do some stress reduction. Now, this may not intrinsically make sense, but many people who suffer with SI joint dysfunction have gone to multiple specialists, have not gotten an answer, have been seeking help for a long period of time, and been very, very frustrated in the process. When you finally find somebody who can help you, it's fantastic, but it can also be very difficult for your body to process that stress of all it's been through. It's been carrying this pain for a while now, and it hasn't gotten the help it's been looking for. So I recommend people do some gratitude journaling, some deep breathing exercises, some gentle stretching, just to reconnect with your body and let it know that you're working on it. You found someone who can actually help you, and you're going to get rid of this pain. Now, the last question I get asked is, should I have surgery for my SI joint dysfunction? Now, you guys know as a physical therapist, I'm not a huge fan of surgery in most cases, unless it's a broken bone or there's blood spurting out from somewhere, then definitely I highly recommend surgery because that's the only way you're going to heal. I will say I have not seen an SI joint surgery go well in my 20 years of practice. When you start cutting on a joint that doesn't move much intrinsically anyway, it's going to create scar tissue, and that scar tissue is just going to bear things down even more. Now, if you do have that sloppy joint and you're like, well, scar tissue sounds good because it'll actually keep it from moving, I'm definitely going to recommend that prolotherapy. It helps to speed up the body's natural healing process. But going into surgery can cause some really big problems and some really big consequences in the long term. Like I said, I have never seen an SI joint surgery go well in all my years of practice. So, there you go. SI joint treatment options, including things like prolotherapy and bracing, and what you can expect if you go to see a physical therapist. Now, it's your turn. Tell me, what questions do you have that I did not answer in this video? I'd love to make a video specifically to answer your questions. And if you're still questioning if you have low back or SI joint pain, I'm going to encourage you to click on this video over here. And of course, if you like this video, I would love to get a nice thumbs up. Have a good one.